जाड्या पहा शुक्लां ब्रह्म विचारसार परमा आद्यां जगद्व्यापिनीं वीणा पुस्तकधारिणीम् अभयदा जाड्यान्धकारापहा हस्ते स्फाटिकमालिकां विदधतीं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम्
Namaste everyone. I think we can proceed now.
Hello, good afternoon, everyone. Myself, Dr. Nitika Gulia, done my BHMS from Nehru Homeopathic Medical College, Delhi University, running my own clinic from past 10 years at Najafgarh. And in ABCA, I hold a position as a social media in charge and students co-wing in charge. Now, I welcome Dr. DC Prajapati, sir, our national president and founder ABCA. Welcome, sir. Welcome, Dr. Neha Kathuria, ma'am, Delhi president, Dr. Dimisha, ma'am, Delhi in charge. Our speakers, Dr. Jasmeen Kaur, ma'am, Dr. Yogita Goel, ma'am, Dr. Rashmi Kapoor, ma'am, Ms. Tanya, Dr. Ashish Sharma, and my colleague coordinator, Dr. Harpreet. Thank you and welcome all for joining us today for this special Mother's Day webinar. We are so happy to have you here as we come together to celebrate and honor the incredible strength, love, and dedication of mothers everywhere. Now, Dr. Harpreet, my coordinator colleague, will say few lines about Mother's Day. Over to Dr. Harpreet.
Hello, everyone. Very, very good afternoon. I'm Dr. Harpreet and I'm the Secretary at Delhi here in ABCA. I would like to say a few lines on Mother's Day. Mother's Day is a beautiful reminder of the unconditional love, strength, and sacrifices that mothers make every single day. It's a time to celebrate their endless dedication and the nurturing spirit they bring into our lives. But while mothers are often the first to care for everyone else, it's equally important for them to care for themselves. A healthy, happy, and fulfilled woman becomes an even stronger pillar for her family. Self-care is not selfish, it is essential. On this Mother's Day, let us honor all mothers by encouraging them to rest, heal, grow, and prioritize their well-being. Because when women take care of themselves, they are empowered to care for the world around them even more beautifully. माँ सिर्फ एक रिश्ता नहीं, वो तो खुदा का दिया हुआ सबसे खूबसूरत तोहफा है. घर कैसा भी हो, माँ के बिना अधूरा ही लगता है. Over to you, Dr. Nikita.
Beautiful lines, Dr. Harpreet. Let's begin this celebration by welcoming our first speaker, Dr. Jasmeen Kaur. Dr. Jasmeen Kaur is a homeopathic physician and pediatrician. She holds a BHMS from Delhi University and MD in pediatrics. She has been practicing past 11 years and founder of Course Care Homeopathic Clinic in Gurugram. Her topic is healing the mother, nurturing the child. Over to Dr. Jasmeen.
Thank you, Dr. Nitika, for such a wonderful introduction. Let me share my screen. And thank you so much, ABCA, for giving me this opportunity to speak today. Hope my screen is shared.
Yes, Dr. Jasmine.
Good afternoon, everyone. Thank you for being here on this wonderful occasion, Mother's Day webinar. There's a beautiful truth in the statement a child's first environment is the mother. From the womb to early childhood, a mother shapes her child's world physically, emotionally, and psychologically. And so, when we care for mother, we are also caring for the child even before the child is born. Today, I speak not just as a homeopathic physician and pediatrician, but also as a mother. I've seen how addressing a mother's well being often brings balance and health to the child. And that's what today's presentation is about healing the mother to nurture the child. Through this talk, I would like to explore how the mother's health, her physical, mental, and emotional well being is the foundation on which child's future is built. This is deeply personal and professional subject for me, and I hope it resonates with all of you. So let's begin. First of all, why this conversation matters. We often talk about saving lives during childhood, but maternal health must mean more than just survival. What about her exhaustion from sleepless night, her anxiety over feeding, her mood swings, or the emotional void she sometimes feels despite holding her healthy newborn? ये एक minor inconveniences नहीं है. These are the indicators of the mother's mental and emotional well-being, which science now confirms is deeply intertwined with her child's development. And this isn't limited to clinical depression, even subclinical emotional exhaustion. जब एक मदर कहती है मुझसे नहीं हो पा रहा है, मैं सिर्फ रूटीन निभा रही हूँ, this also can disrupt the sensitive emotional balance between mother and the baby. As doctors, we cannot separate the newborn's health from the mother's health. They are not two patients, they are the biological and emotional system. So, moving on to our next slide. Maternal health is more than just survival. As clinicians, we often equate success in maternal care with the survival of the mother and child, and all available data revolves around it. And yes, survival is essential, but it is the starting point, not the end point. Maternal health includes physical recovery, emotional healing, mental resilience, and social well being, not just during the pregnancy, but in the months and years that follow. But sadly, हमारे healthcare system में we often stop caring for the mother once the baby is born. But the real journey starts then, and this neglects lead to long-term consequences, not just for the baby and not just for her, for the whole society. Mother's body undergo immense transformation hormonally, structurally, and energetically. So does her emotional world. Maternal health should be about thriving, not merely surviving. Many mothers express this in simple but powerful words. बहुत पेशेंट्स आके ऐसे कहते हैं डॉक्टर साहिबा थकान उतरती नहीं है और सब कुछ संभालना पड़ता है and we nod knowing that behind that one sentence is a plea of support. That exhaustion, that feeling of invisibility is common but rarely acknowledged. Even science backs this broader perspective. The WHO defines maternal health as not only the absence of disease or death, but a state of complete physical, mental, and social well being. Now, what? द मदर चाइल्ड हेल्थ कंटिन्यूम जो मदर और चाइल्ड का हेल्थ का कनेक्शन है दैट कनेक्शन बिटवीन मदर हेल्थ एंड चाइल्ड एक लीनियर नहीं है इट इज अ सर्कुलर और डायनामिक स्टार्टिंग इन यूट्रो बेबी एक्सपीरियंसेस एवरीथिंग द मदर डज हर न्यूट्रिशन हर स्ट्रेस हार्मोन उसके स्लीप साइकिल्स जो मेटर्नल कॉर्टिसोल लेवल्स होते हैं फॉर एग्जांपल दे कैन अफेक्ट द फीटल ब्रेन डेवलपमेंट दिस वी कैन डिस्कस इन डिटेल लेटर एंड मदर काम है nourished है इमोशनली सपोर्टेड है तो fetus tends to thrive. If she is under distress, emotionally or physically, it affects everything from placental blood flow to fetal neurodevelopment. ये जो connection है ये postpartum भी continue करता है. That is why the mother-child health continues. A mother's ability to breastfeed, bond, and respond to her baby is tied closely to her mental state and energy reserves. A child health isn't separate, it is deeply nested within maternal health. As doctors, we see the child, but we must also see the mother behind them. A mother's tone, expressions, eye contact, Teach the baby how to regulate emotions, and depression can disrupt this cycle. Babies of depressed mothers show higher cortisol levels, indicating stress. एक मदर ने रिसेंटली मुझे कहा कि मेरा स्ट्रेस का असर बच्चे पर पड़ रहा है, एंड शी वाज एब्सोल्युटली राइट. दैट्स व्हाई वी से नर्चर द मदर एंड यू नर्चर द child. So now we will discuss the prenatal impact in detail. During pregnancy, mother emotional state deeply influences the fetus. First of all, जो elevated cortisol levels होते हैं वो मेटर्नल जो वो एलिवेटेड कॉर्टिसोल लेवल्स प्लेसेंटा क्रॉस कर सकते हैं एंड इम्पैक्ट्स द ब्रेन स्ट्रक्चर सच एज amygdala and hippocampus. Can anybody text in the chat box and tell me what are these structures responsible for amygdala and hippocampus? हमारे कौन से ब्रेन पार्ट को ये इन्फ्लुएंस करते हैं एंड व्हाट आर दीज फॉर? They are responsible for emotion and memory. And this alters the fetus HPA axis. एक स्टडी भी हुई थी बायोलॉजिकल साइकेट्री में 2011 में दैट सपोर्टेड द स्टडी कि जो HPA एक्सिस ऑल्टर हो जाता है व्हेन मदर कॉर्टिसोल लेवल इज एलिवेटेड. अब जो मदर का डिप्रेशन होता है इज ऑल्सो लिंक टू प्री टर्म बर्थ एंड इंट्रा यूट्राइन ग्रोथ रिटार्डेशन leading to low birth weight. These are well established predictors of poor development outcomes. Maternal depression एक just emotional issue नहीं है, that is a profound biological effect on pregnancy outcome. First, अगर chronic stress है, depression है, that will activate the HPA axis, raising the level of cortisol and placental CRH. Can someone text what is CRH in the chat box? Placental CRH. Placental CRH is the corticotropic releasing hormone. एंड ये एक स्ट्रॉन्ग ट्रिगर होता है अर्ली लेबर के लिए एंड देयर आर स्टडीज दैट लिंक्ड हाई मिड प्रेगनेंसी सीआरएच टू शॉर्टर ड्यूरेशन. सेकेंड, जब डिप्रेशन हो रहा है दैट कॉजेज सिंपैथेटिक नर्वस सिस्टम एक्टिवेशन. अब जब सिंपैथेटिक नर्वस सिस्टम एक्टिवेट होगा तो नैरोइंग ऑफ ब्लड वेसोकंस्ट्रिक्शन होगी जिसकी वजह से नैरोइंग ऑफ ब्लड वेसल्स होगी. ब्लड वेसल्स नैरो हो गई दैट रिड्यूसेस द ब्लड फ्लो टू द प्लेसेंटा लिमिटिंग ऑक्सीजन एंड न्यूट्रिएंट्स. अब ऑक्सीजन एंड न्यूट्रिएंट्स लिमिट हो जाएंगे तो ऑब्वियसली देयर विल बी इंट्रा यूट्राइन ग्रोथ रिटार्डेशन. थर्ड, देयर इज अ स्ट्रॉन्ग इन्फ्लेमेटरी कंपोनेंट. डिप्रेशन जो है वो इंक्रीज कर देता है साइटोकाइंस लाइक IL-6 एंड TNF अल्फा जो प्रमोट करते हैं प्लेसेंटल इन्फ्लेमेशन को एंड दिस मे कंट्रीब्यूट टू मेम्ब्रेन रप्चर और प्री टर्म यूट्राइन कॉन्ट्रैक्शंस. फाइनली, बिहेवियरल फैक्टर्स लाइक अगर मदर वाज नॉट रेडी फॉर द प्रेगनेंसी या शी इज नॉट टेकिंग सेल्फ केयर तो पुअर सेल्फ केयर होगी, मिस्ड चेकअप्स होंगे एंड सब्सटेंस यूज कैन ऑल्सो बी देयर इन डिप्रेस्ड मदर. दीज ऑल वर्सन द आउटकम्स. सो द लिंक बिटवीन maternal mental health and fetal outcomes is real, multi-dimensional and demands early attention. Additionally, जो chronic maternal stress है that can lead to epigenetic modifications, which means the baby's genes may express differently. These changes can increase the child's susceptibility to anxiety, ADHD, and behavioral issues later in the life. इसी जो अभी हमने डिस्कस किया इसी को एक थ्योरी जो है वो फुल सपोर्ट करती है, जो हैट थ्योरी. Let's talk about it. It's a fascinating and foundational concept in preventive medicine and maternal childhood. This theory stands for the developmental origins of health and disease. This theory tells us that many chronic diseases we see in childhood actually have their roots much earlier, in the womb or even before conception. It's based on the idea that early life exposure, especially during pregnancy and infancy, can program the body in ways that affect long-term health. For example, अगर mother जो है वो undernourished है during pregnancy, the fetus may develop, adapt कर लेता है वो एक thrifty metabolism को, designed to conserve energy. But if the child grows up in an environment with plenty of food, this mismatch can lead to obesity, diabetes, or heart disease later in life. These early influences जो हैं इनको हम कहते हैं fetal programming. And they shape how organs develop, how genes are expressed, and how body responds to stress or nutrition even decades later. This theory also highlights the concept of critical window in development, especially the first 1,000 days from conception to child second birth. ये वाला जो टाइम होता है ये highly sensitive होता है ब्रेन के लिए, immune system, metabolic pathway, इन सब के लिए. इस टाइम पे positive and negative both influences are maximum. Another key part of this theory is epigenetics, how environmental exposures like stress or toxins can switch genes on and off without changing the DNA itself. These changes can last lifetime and in some cases they can even affect the next generation. The takeaway here is a powerful. If we focus on maternal, parental care, and the early childhood support, we are not just caring for the mother and child in the present, we are also shaping the future health of individuals, families, and even communities. So, this theory urges us to think long term. Healthy beginnings lay the foundation for healthy lives, and that's how our work in maternal child health is truly transformative. Moving on to the postpartum. Now we have discussed prepartum in detail. Now let's move on to the postpartum impact, mental and emotional interplay. This slide touches the core of maternal well-being, the mental and emotional landscape that often goes unseen but deeply shapes both mother and child. When a mother is navigating postpartum depression or anxiety, her ability to connect, nourish, and emotionally attune to her child can be significantly affected. And I say this not just as a pediatrician or homeopathic physician, but as a mother who has lived it. After my delivery, I returned to my clinic earlier than I emotionally felt ready for. I had responsibilities, patients who depended on me, but every time I left home after expressing milk, I carried a quiet guilt inside me. कहीं मैं selfish तो नहीं हो रही, कहीं मैं अपने बच्चे के साथ गलत तो नहीं कर रही. And many mothers go through the same phase. So let's discuss postpartum depression in detail. Postpartum depression just baby blues nahi hai. Don't confuse it with that. It affects 1 in 7 new mothers, even more in high stress setting. It is a serious, diagnosable mood disorder that can occur anytime within the first year after delivery. The mother may look fine from outside, but may be battling persistent sadness, crippling guilt, or the inability to feel joy even while holding her healthy baby. Often क्या होता है people comment करते हैं सब तो ठीक है पर उदास क्यों हूँ, and this only adds to her shame and isolation. जो सिम्टम्स हमें जनरली देखने को मिलते हैं पोस्टपार्टम डिप्रेशन में, दैट कुड बी persistent sadness, irritability, fatigue, sleep disturbances, difficulty bonding with baby, feelings of hopelessness or worthlessness. What's worse is when it goes undiagnosed, especially in cultures when women feel pressure to appear strong or selfless. When you are a mother, to everyone accept that you will be completely selfless and you are just caring for the baby. But what you are feeling inside you, that also matters. And science also tells us that untreated PPD affects the baby too, and it affects how the mother reflects to her baby. She may struggle with bonding, responding to cues, or maintaining routines like feeding and sleep. And children raised in such environment may show signs of insecure attachment, delayed milestone behavioral changes. एक study भी हुई थी, landmark study by Murray in 2003 that showed that infants of mother with untreated postpartum depression had delayed language and behavioral issue at 18 months. Because postpartum depression is so common and still it is goes undiagnosed many a times, so that's why इसकी screening is very important. बिकॉज ये बहुत बार मिस हो जाता है पोस्टपार्टम डिप्रेशन, बिकॉज समटाइम्स मदर हेजिटेट टू स्पीक अप, मे बी गिल्ट की वजह से, फियर ऑफ जजमेंट की वजह से, और कल्चरल साइलेंस जो सारी मेंटल हेल्थ डिजीज के आसपास घूमता है कि वी शुड नॉट डिस्कस आवर मेंटल हेल्थ. दैट्स व्हाई वी मस्ट स्क्रीन प्रोएक्टिवली, नॉट जस्ट वेट फॉर द रेड फ्लैग्स. कब करना चाहिए स्क्रीन? जब 6 वीक पोस्टनेटल विजिट होती है, या बेबी को वैक्सीनेशन के लिए लेके आ रहे हैं, या बेबी को होम्योपैथ के पास हमारे पास लेके आ रहे हैं कोई स्मॉल इशू के लिए. इवन इफ मदर इज नॉट शोइंग हरसेल्फ, वी शुड स्क्रीन ड्यूरिंग रूटीन चाइल्ड हेल्थ चेकअप्स. वी शुड स्क्रीन. एंड हाउ? आस्क ओपन एंडेड क्वेश्चंस. उससे पूछो हाउ आर यू फीलिंग. And there are 2 validated tools that are commonly used. The first one, which I also use in my clinic, is the Edinburgh's Postnatal Depression Scale, EPDS. एक 10 question survey है that's help qualify depressive symptoms. And the second is PHQ-9, जो I guess हम सबको पता होगा because that's the most common scale जो depression के लिए use होता है. But more than any tool, listening empathetically matters more. Simple questions like कैसा feel कर रहे हो माँ बनने के बाद can open the door for honest dialogue. If the mother mentions loss of joy, feeling disconnected from the baby, or severe fatigue, these are early warning signs. We don't need to be mental health specialists to screen, we just need to be present, observant, and open. एक बार हम Edinburgh postnatal depression scheme, because this is very important, let's discuss in detail. It is one of the most widely used and validated tools to screen for postpartum depression. ये एक self-reported questionnaire है with 10 items that assess the mother's mood and emotional well-being over the past week. I'll also show how this looks like. This is how the scale is. These questions are not just about sadness, they also explore guilt, anxiety, panic, and thoughts of self harm. This helps differentiate between baby blues and Killington depression. Each response, as you can see on the screen, these are the type of question. Each response has four. Each question has four responses: 0, 1, 2, 3. And a total score above 10 warrants closer observation. A score above 13 typically suggests the need for further psychological evaluation or intervention. But more importantly, question number 10, that is, the thought of harming myself has occurred to me. That is a red flag and it needs urgent action. This tool doesn't diagnose but helps us as clinicians identify mothers who may be suffering in silence. It's quick and can be done in clinics or at home and empowers early support. अब इसकी स्कोरिंग कैसे होती है? 0 to 9 टोटल 30 मार्क्स का स्कोर हो सकता है इसमें. 0 to 30. 0 to 9 इज लो रिस्क. 10 to 12 इज माइल्ड रिस्क. मॉनिटर और रीएसएस, एक वीक बाद आप दोबारा मदर को बुला सकते हो उसे एट होम रीएसएस करने के लिए. देन शेयरिंग विद यू कैन से 13 plus is high risk that needs urgent care. And red flag is the question number 10. If its answer is anything above other than never, then it's a red flag. Now let's talk about counseling. How counseling can help in the maternal health. Counseling is not just an intervention, it is a form of maternal care that touches the emotional core of motherhood. It creates a safe, non judgmental space where mothers can share what they're often afraid to admit, their fears, doubts, and feeling of overwhelm. Through regular counseling, we can catch early signs of postpartum depression and anxiety before they escalate. Mothers who feel heard and understood are more likely to seek help and less likely to internalize guilt. Counseling also strengthens the mother infant bond by easing the pressure to be perfect. एक जो एक society वाला pressure है, when you are a mother you have to be perfect, it ease that pressure. We help mothers tune into the baby rather than to social expectation. It is also incredibly empowering mothers make more confident choices about breastfeeding, work-life balance, and self-care when they have had a chance to talk it through. And perhaps most importantly, it reduces the isolation that mothers silently suffer from. A kind word, a listening ear, these are healing tools too. Now, also, we should talk about the overlooked side, the physical toll of motherhood. पोस्टपार्टम के जो फिजिकल चैलेंजेस हैं वो ऑफन गो अननोटिस, स्पेशली जब वो 40 डे का कंफाइनमेंट पीरियड ऊपर हो जाता है. उसके बाद नोबडी आस्क्ड कि हाउ इज योर फिजिकल हेल्थ. एक 2021 में स्टडी भी हुई थी इन बीएमसी प्रेगनेंसी एंड चाइल्डबर्थ दैट शोड दैट 80% ऑफ मदर्स एक्सपीरियंस अनट्रीटेड फटीग एंड मस्कुलोस्केलेटल पेन 3 months postpartum. Many mothers continue to suffer in silence with back pain, poor posture हो सकता है during breastfeeding, urinary incontinences due to weakened pelvic floor muscles, iron and calcium deficiencies from repeated pregnancies या फिर poor diet है, and chronic fatigue जिसको तो normally एक normal motherhood exhaustion कह के ही ignore कर दिया जाता है. Even lactation, जो strongly promoted होता है, comes with its own physical challenges like cracked nipples, breast engorgement, and mastitis. In the long term, if not supported, they are at risk of early osteoporosis, especially जो breastfeeding mother है and poor nutrition wear, they are very much prone to early osteoporosis. Cardiometabolic diseases, particularly in women with a history of gestational diabetes or preeclampsia, and yet many women are never called back for a comprehensive postnatal checkup after 6 weeks. As physicians, especially in primary care, we need to actively screen, counsel, treat, and refer these mothers because when a mother is physically strong, she parents with more confidence and energy. And when we are talking about the physical aspect, so obviously breastfeeding, that's the most important. This slide highlights how breastfeeding is not just a passive process, it's a dynamic and deeply influenced by what the mother eats. वाइल जो ब्रेस्ट मिल्क है वो अगर मतलब अंडर न्यूट्रिशन में भी है, कोर कंपोनेंट्स ब्रेस्ट मिल्क के वैसे ही रहते हैं, बट मेनी न्यूट्रिएंट्स लाइक फैट सॉल्युबल विटामिन्स लाइक ए डी ई एन के एंड वाटर सॉल्युबल विटामिन्स लाइक B12 दे कैन वेरी विद द मैटरनल इनटेक. फॉर इंस्टेंस मदर जो कि ज्यादा DHA रिच फूड कंज्यूम करती हैं, कैन एनीवन टेल मी विच आर द DHA रिच फूड्स? प्लीज टाइप इन द चैट बॉक्स. Which all are the DHA rich foods? Yes, absolutely right, Dr. Harpreet, Dr. Neha. So mothers who consume DHA-rich foods like fish, flax seeds, egg have milk that supports better neurodevelopment in the baby. Similarly, maternal diet rich in antioxidants and micronutrients like jasmine, zinc, and selenium can boost the infant's immune system. Interestingly, what mother eats also influences the baby gut health. Probiotic and dietary fiber जो है, that also shape the breast milk microbiota which colonizes in the infant's gut. On the flip side, maternal अगर deficiencies हैं, especially B12 की, vitamin D की और iodine की, can lead to clinical symptoms in the baby, including poor growth or even neurobiological delays. Finally, जो food allergens हैं, consumed by the mother, वो trace amount में baby में pass हो सकते हैं. ये कुछ हद तक beneficial भी हैं. Some studies suggest that they are beneficial and it helps reduce allergies, but in rare cases, it can lead to sensitivity as well. अब बात करते हैं न्यूट्रिशन फॉर द पोस्टपार्टम रिकवरी. न्यूट्रिशन जो है इज नॉट जस्ट अ फ्यूल, इट्स अ थेरेपी, स्पेशली इन द पोस्टपार्टम पीरियड. After delivery, a mother's body is in a state of healing, recovering from blood loss, hormonal fluctuations, sleep deprivation, and often emotional exhaustion. The truth is, a depleted mother cannot fully nourish her child. So our goal is restoration of nutrients, energy, and strength. So basic से start करते हैं. Basic is iron. वो crucial है replenish करने के लिए post delivery blood loss and prevent fatigue. Calcium and vitamin D are essential not just bone health के लिए but also to regulate mood and prevent long-term depletion, especially breastfeeding mothers में. Omega-3 fatty acids, especially DHA, supports both brain health and emotional resilience. They are anti-inflammatory and shown to reduce risk of postpartum depression. जो मैं जनरली एडवाइस करती हूँ अपने पेशेंट को, दैट इंक्लूड घी, सोप नट्स, सीड्स, लीफी ग्रीन्स एंड सीजनल फ्रूट्स इन एवरीडे मील्स. A warm, nourishing meal with whole food supports digestion, lactation, and immunity. And most importantly, hydration. Hydration is the key. At least 2.5 to 3 liters a day, especially for breastfeeding mothers. And fibers from fruits, vegetables, and whole grains helps with common postpartum issues like constipation and sluggish digestion. I recommend small balanced meals every 3 to 4 hours to keep blood sugar stable. This helps reduce irritability and energy crashes, which many new mothers complained about. हमारी mothers, mother-in-laws कहती है ना, पहले खुद खा लो, then बच्चे को feed करो. This is the reason. One more important point to remember, food is also emotional support. Traditional postpartum diets often given by mothers or grandmothers have wisdom in them. Let's blend that tradition with science. That's the homeopathic and holistic approach. अब एक important topic कि pediatric mirror. This is one of the most important principle I have come to understand over the years, that children mirror their mothers. In my practice, I have often seen children important for issues like recurrent colds hai, unsettled sleep hai, irritability, colic hai, and surprisingly, when we start addressing the mother's emotional state, the child's symptoms begin to improve, even without medication at times. And why does this happen? Because child का जो nervous system है is still co-regulating with the mothers. The emotional environment of the home, especially mother की state, directly affects the child mood, immune system, and behavior. We must remember that maternal stress, unexpressed grief, or emotional burnout can show up in child's body through tummy aches, temper tantrums, bedwetting, or even silence. In home where there is emotional tension, arguments, or unspoken distress, we often see children displaying behavioral dysregulation. They become clingy, aggressive, or withdrawn. That's why I say every pediatric consultation must begin with the question, how is the mother? As pediatricians, we are trained to observe the child, but sometimes the root of the issue lies in the mother's unspoken emotional pain. Addressing her is the first step towards healing the child. And this is where homeopathy and counseling come together beautifully, treating the child holistically, but not in isolation. Because ultimately, child's wellness often begins with the mother being seen, heard, and healed. Next, we move to role of homeopathy. Unlike conventional medicine, homeopathy obviously offers a non suppressive and individualized approach that doesn't interfere with lactation, sleep patterns, or energy level. It aligns beautifully with the needs of new mothers who often fear dependency or side effects. We all are doctors, obviously we all know the basic remedies जो हम postpartum depression या otherwise depression, anxiety में, maternal issues में use करते हैं. But I'll just give a brief. Like first remedy that comes to mind is sepia. That is a classic remedy for postpartum indifference, in irritability and emotional detachment. Sepia mother क्या बोलेगी? I love my baby, but I feel nothing. She's worse with consolation and better with exercise or being alone. She feels like she's a machine, disconnected from the family life, from her partner. And physical symptoms जो हमें guide करेंगे, that could be pelvic weakness, prolapse, aversion to coitus. Next we can think of natromune. उसमें silent grief है, suppressed emotion है, feels isolated. She craves solitude, avoids crying in front of others. जो natromune mother होती है वो very duty bound होती है but emotionally numb. And there could be history of miscarriage or unresolved grief during pregnancy. Physical symptoms जो हमें generally मिलते हैं natromune, migraines, headache, anemia, dryness of skin. Pulsatilla also works wonder in maternal postpartum symptoms. ये opposite है natromune से. ये VP है, emotional है, needs constant reassurance and company. Changeable mood है, very affectionate है with baby but very anxious. Gentle है, yielding है, worse in warm room, better in open air जो इसका general वो है. ये often pulsatilla किन में काम आती है? First time mothers with hormonal imbalance and mild anxiety. Ignatia is also one of the good remedy. उसमें acute grief है या emotional shock है, especially अगर delivery traumatic थी. इसमें contradictory symptoms होंगे, laughing, then crying. She feels choked up, sobbing silently, sighs often. Physical throat constriction हो सकती है, erratic appetite, twitching. We can also think of Kalika. The oversensitive mothers होती हैं, especially to criticism. They can't take criticism. They try to hold it together. Publicly they will look like they are very composed. They have उन्होंने अपना वो जो मदर वाला रोल है बड़ी easily अच्छे से adapt कर लिया है, but silently जो है वो उस चीज से crumble हो रही हैं. They try to hold it all together but crumbles in private. Fear of death होता है and very conscious about baby safety. इसमें physical symptoms could be night sweats, backache, insomnia from over responsibility. Next, we could also think of lycopodium, insecure, doubts herself, especially if family dynamics are strained. May become irritable with baby or partner. इसमें digestive issues हो सकते हैं, bloating, gas, low confidence. Feels better once she gains some control because lycopodium female को control चाहिए. So if she's in control, then she feels better. And next, अगर suicidal thoughts are very prominent, then we can think of Auromed. उसमें severe depression है with suicidal thoughts, especially if mother feels like a failure. Sense of worthlessness, better from prayer, music. ये often कब use होती है? After C-section या complicated delivery होती है where self-image is damaged. Then we can think of Auromed. She needs careful monitoring and it should be used under supervision. केस टेकिंग में हम क्या कर सकते हैं कि एक्सप्लोर फीलिंग्स अबाउट बर्थ एक्सपीरियंस. हमें मेडिसिन डिसाइड करने से पहले ऑब्वियसली व्हेन वी नीड द केस टेकिंग तो उससे पूछना है कि व्हाट आर थॉट्स रन थ्रू योर माइंड व्हेन यू आर अलोन. हाउ डू यू फील अबाउट योरसेल्फ एज अ मदर, सो दैट वी कैन गो ऑन दैट लाइन. Homeopathy doesn't just treat the mood, it supports the emotional reintegration of the mothers into her identity, her body, and her family. One mother, after a few weeks of treatment, told me, अब थोड़ा हल्का महसूस हो रहा है, नींद भी अच्छी आ रही है. That's when I knew healing had begun. Not just physically, but emotionally, and that healing naturally radiated to the child. थोड़ा हम एक फास्ट से केस रिव्यूज कर लेते हैं. आई वोंट डिस्कस द केसेस इन डिटेल्स, मैं एक समरी देती हूँ. फर्स्ट केस था एक 32-year-old मदर का. शी वॉज अ न्यू मदर, कुडंट स्लीप डिस्पाइट एक्सट्रीम एग्जॉशन. शी टोल्ड मी, मुझे लगता है सब कुछ मेरे ऊपर ही है. After taking other symptoms, CPR was prescribed, her irritability reduced, and she slowly began bonding more positively with her baby. Second case जो था, सेकेंड केस हैड अ हिस्ट्री ऑफ ट्रोमैटिक बर्थ. और उसका एक पॉइंट क्या था, दैट शी डिडंट क्राइड इवन वंस सिंस हर डिलीवरी. शी लुक कंपोज बट फेल्ट हॉलो. बाकी सिम्टम्स लेने के बाद इग्निशिया वाज प्रिस्क्राइब्ड दैट हेल्प हर रिलीज रिप्रेस्ड ग्रीफ, एंड शी डिस्क्राइब इट एज फाइनली एक्सेलिंग. Third case that I will discuss was of a young mother जो joint family में रहती थी. The mother felt overwhelmed with responsibility and felt invisible in the joint family. Pulsatilla was prescribed, and after that she felt more supported, emotionally resilient, and connected with her baby again. These cases reaffirm that emotional healing is just as clinical and just as measurable as physical symptoms. ये होम्योपैथिक पार्ट हो गया. नाउ लेट्स मूव टू द योगा. इसमें आई गेस डॉक्टर नेहा हमें ज्यादा अच्छे से गाइड कर पाएंगी, बट आई जस्ट गिव अ ब्रीफ. योगा जो है, योगा हैज बीन वन ऑफ द मोस्ट ग्राउंडिंग प्रैक्टिसेस इन माय ओन जर्नी, नॉट जस्ट एज अ डॉक्टर बट एज अ मदर. When I experienced postpartum depression, yoga gave me the mental space to connect with myself, to breathe through the overwhelm, and to slowly rebuild strength, not just in my body, but in my confidence and calm. Scientifically, जो योगा है वो सपोर्ट करता है पैरासिम्पैथेटिक नर्वस सिस्टम को, which helps low cortisol level, जिसकी वजह से मूड रेगुलेट होता है. This makes a big difference for pregnant or postpartum women who are often overwhelmed, anxious, or emotionally exhausted. Physically, yoga circulation improve करता है, posture, and helps with discomfort from pregnancy like backache and pelvic tension. Emotionally, yoga foster mindfulness and self-awareness. It helped me recognize my own emotional state without judgment and respond to them with kindness. It also prepares the body for labor, teaching pain management through breath and increasing pelvic flexibility. And finally, in the postpartum phase, yoga is not just a tool for recovery. It becomes a safe space for healing. It restores hormonal balance, rebuilds the core, and brings clarity. I truly believe that incorporating yoga under a trained prenatal yoga instructor can transform maternal care just as it did for me. I'd also like to discuss one case where I integrated homeopathy and counseling together. This case involved a 29-year-old first-time mother who presented to my clinic feeling emotionally overwhelmed. She cried easily, felt like she was failing as a mother, and was racked with guilt over supplementing with formula. During her pregnancy, she was very well prepared that I won't give the formula milk, I will just breastfeed. But due to some circumstances at home, itna support nahi tha, she had to shift to supplementing with formula as well. She also reported trouble sleeping and feeling numb towards her baby at times. I began with counseling. First few sessions we focused on validating her emotions and normalizing the struggles of new motherhood. We unpacked her guilt and explored the unrealistic expectations she had internalized. With time, we reframed her narrative from I am failing to I am adapting. Parallelly, I prescribed Pulsatilla 200. Her emotional lability, craving for emotional support, and hormonal shifts matched the remedy well. Within 10 days, there was a visible softening. Later, as exhaustion and indifference became dominant, CPR 30 helped rebalance her mental state. In 4 weeks, the transformation was profound, not just emotionally, but psychologically. Her sleep improved, feeding became more intuitive, and she began to bond with the baby more naturally. This case reaffirms the power of an integrative approach when homeopathy and counseling work together. We support the mother wholly. Now, let's talk about the forgotten support system, family and community. We often forget that a mother doesn't heal in isolation, she heals in community. As doctors, we focus on clinical care, but we must also look at the environment she's going home to. We need to ask, is her partner supportive? Is she judged by in laws for not being cheerful all the time, like she was before pregnancy? Does she have help with the night feeds or household responsibilities? I remember one patient जिसने मुझे बोला था recently, मुझे लगा मैं अकेली हूँ जिससे ऐसा लगता है. That feeling of being alone in her struggle is something we can't overlook. And here's something powerful to remember: a mother never forgets who stood by her during postpartum. Not the gifts, not the advice, but the presence, the support, the people who saw her pain and stayed. एंड बाय जेंटली एजुकेटिंग फैमिली मेंबर्स, जो भी उसके साथ उसका हस्बैंड आ रहा है, मदर इन लॉ आ रहे हैं, कोई भी फैमिली मेंबर आ रहा है, वी नीड टू टेल दम वो सिर्फ हार्मोनल नहीं है, वो हील कर रही है. बाय टेलिंग दिस वी क्रिएट अ सेफ अंडरस्टैंडिंग स्पेस वेयर मदर्स फील सीन. Let's work together to ensure that no mother feel unseen, unheard, or alone in her healing journey. Now, what can we do as doctors? As doctors, we often focus solely on the child during visit, but what if we expand our lens just a little wider? Include maternal well-being questions in child visits. When a mother brings her child for a cold or a rash, just take 30 seconds to ask her, और आप कैसे हो? This simple check in can reveal emotional exhaustion, anxiety, or silent struggles. Acknowledgement is the first step towards healing. Use empathy, not just evaluation. Clinical knowledge is essential, obviously, but healing comes through connection. When a mother hesitates or tears up, don't rush past it, hold space for her. Let's listen beyond symptoms, listen to her story, her silences, and also importantly, collaborate across systems. We must move beyond whether we are gynecologist, pediatrician, homeopaths, or general physician. The mother needs integrated care. Her emotional state, physical recovery, and the child's well being are all interlinked. Let's build bridges, refer, communicate, and work as a team. We have the opportunity not just to treat, but to truly care. And when we care for the mother, we strengthen the very foundation of the child's health. Moving on to our last slide. As we conclude, I want to leave you with this message: healing begins with us. When we make space for a mother's healing, physically, emotionally, and spiritually, we are not just helping one person, we are shaping the emotional and developmental health of an entire generation. This is a ripple effect. A nurture mother becomes a safe haven for her child, and the child grows up with the strength to nurture others. So, whether you are a healthcare professional, a family member, a friend, or a mother yourself, know that your support, your care, your presence matters deeply. Let's make maternal health not just surviving it, but truly healing through it, a shared responsibility. Because when we heal the mother, we nurture the next generation. Thank you so much, everyone, for your time and attention and your dedication to this mission. You're all part of this healing journey. Thank you for joining me today. I hope this talk offer insights and heart. Let's make space for the mothers to be cared for just as they care for everyone else. Thank you all. I welcome any questions.
Thank you so much, Dr. Jasmeen. Your insights were truly enlightening and added immense value to our understanding. Thank you for sharing your expertise on postnatal problems and their homeopathic management. If anybody has their queries, they can obviously just, ask her any questions or any doubts or anything they want to add.
Sure.
Participants are muted, so they can ask their questions in chat box.
Okay, sure. Then I would request our national head, Dr. Prajapati sir, to please hand over the certificate to Dr. Jasmeen. प्रजापति सर प्लीज आप कुछ लाइंस भी बोलें डॉक्टर जैस्मिन के बारे में प्लीज.
Till the Prajapati sir join, I would like to add, it was a great presentation, doctor. And it was amazing. आपने overall सारी चीजें cover करी, from the emotional, mental, physical health being, and that is the beauty. And the most important, your presentation is very nice. The way you have expressed, and the animations you have used, it is very engaging and very nicely and very clean presentation. So I think the message which you have want to convey to the people, convey to all the doctors, it has been conveyed. It is amazingly expressed. And हम कहते ना कि हम सब मदर्स हैं यहाँ पर, एंड दैट्स व्हाई वी आर सेलिब्रेटिंग इट. एंड ABCA में 70 to 80% आर द women doctors. So ये जो भी आपने points बोले, we have experienced our own self as well as and we have seen the patients. So it is very, very close knitted topic to all the women doctors.
Yes,
So you
ma'am,
have expressed
definitely.
it very nicely, and the line you have said कि वो बहुत ही touching था कि कोई भी mother नहीं भूलती जब during that after pregnancy कि कौन उसके साथ खड़ा था और कौन उसके लिए टेक केयर कर रहा था. दिस इज द इमोशनल एस्पेक्ट एंड आई थिंक ये सबको टच किया होगा और सबको अपना टाइम याद आ गया होगा.
Seriously, I totally agree to Dr. Neha. This is absolutely true. And it was a very beautiful
Absolutely, Dr.
presentation.
Neha.
There is one query.
And-
One doctor has asked, ma'am, after LSCS, when can we start yoga? After how many days?
ये मैं आंसर कर देती हूँ. इफ यू वांट टू जस्मीन, you want to answer, you didn't do it,
No,
please.
no, ma'am, you can definitely. Yoga is your area.
क्योंकि इट वाज जस्ट केम. आप 3 months के बाद स्टार्ट कर सकते हो फिजिकल प्रैक्टिसेस, बट जस्ट आफ्टर डिलीवरी यू कैन डू प्राणायाम. ठीक है. इफ यू आर इन आफ्टर द CS, आफ्टर CS आप 3 months के बाद फिजिकल एक्टिविटीज में आसनास एंड क्रियाज आप स्टार्ट कर सकते हो, बट प्राणायाम एंड मेडिटेशन आप नेक्स्ट डे से भी स्टार्ट कर सकते हो और बिफोर एंड दैट नो प्रॉब्लम. आई होप आई हैव मेंट आंसर्ड नाइसली. I think Dr. Prajapati sir, we need you here. Okay. Okay, no problem. Dr. Ma'am, Dr. Dimsha ma'am, you please do the honor.
Dr. Avneet will give the certificates. Dr. Avneet, please.
Yes. Yes, Dr. Avneet ma'am, she's our General Secretary. Avneet ma'am, you please do the honor to felicitate Dr. Jasmeen. Please unmute yourself.
Unmute yourself, Dr. Avneet.
Unmute yourself, Avneet ma'am. Ma'am, we cannot hear you. आप unmute कीजिए.
Is she in panelist, or ask Dr. Naval, Mr. Naval to give her the access, please? Yes.
Yeah, good evening, everybody. Yeah, it's a very informative and very knowledgeable topic, which is by Dr. Jasmeen. So I really thankful to Dr. Jasmeen. And हम इनको certificates जो है इनका the certificates proudly present to Dr. Jasmeen. So it's a great honor कि आपने बहुत अच्छा भेजा. Very, very congrats to you and give a big hand to her. Thank you very much.
Thank you so much, ma'am. Thanks a lot.
Yeah.
Dr. Nitika, please
Yes,
continue.
yes. Hello, everyone. Now there is a small introduction about our President Delhi, Dr. Neha Kathuria, ma'am, MD, Home, BHMS, MSc Yoga, is a senior homeopathic and yoga consultant with 14 years of experience visiting faculty at Amity Institute of Indian System of Medicine, former yoga consultant at Ministry of Ayush, practicing at Dr. Neha's Faith Healing Homeopathy and Yoga Clinic. She will tell few details about ABC and its working and membership. Please, Dr. Neha.
Hello, everyone. Hello, everyone. I hope I'm audible. Yes, welcome you in ABCA, as ABCA is Akhil Bharatiya Chikitsak Association. In a very short duration, I will explain what are the motives and what are the aims of ABCA. ABCA, जिन्होंने start किया था Dr. DC Prajapati sir, 2002 में he has started this and registered this organization. Since last year, we all been get together and make a very good association and working for homeopathy and promotion of homeopathy. ये प्लेटफॉर्म सिर्फ प्रमोशन के साथ साथ अपने जो न्यू कमर स्टूडेंट्स हैं उनको प्रमोट करने के लिए भी है, नॉलेज शेयरिंग के लिए भी है, लीगल इश्यूज के लिए भी है, यहाँ पर बहुत सारे हमारे एम्स एंड ऑब्जेक्टिव हैं जिनको हम कवर करते आ रहे हैं, एंड सिंस लास्ट ईयर वी हैव कवर्ड मेनी टॉपिक्स, एंड दिस वेबिनार इज वन ऑफ द एग्जाम्पल ऑफ कंटिन्यूड मेडिकल एजुकेशन। हमने रेगुलर बेसिस पे अपनी नॉलेज शेयरिंग हम कंटिन्यू रख रहे हैं। Plus, important part of ABCA is the legal, which make it different from other organization, is the medical legal concept. यहाँ पर डॉक्टर DC प्रजापति जो he is a medical advisory and he is the national founder of ABCA, and इन्होंने he is a medical person as well as he is a legal background. इन्होंने ये एसोसिएशन का जो मोटिव है वो ये रखा है कि हम सब होम्योपैथ्स को एक लीगल सपोर्ट भी रेगुलरली मिलता रहे, regarding how the registration has to be done, regarding how the new clinic has to be start up, what are the links we can generate, और अपनी clinic practice में basically as a job, it is okay when you get for a job, you study and you crack some government job, that is the different thing. But when we talk about the private setup, it becomes difficult for a new child, new pass out, how to generate a new setup. वहां पर हमारे पास बहुत सारे senior doctors हैं यहाँ पर, which who guides us how to have a better practice, how to have a tips of marketing. Everything is been discussed in ABCA, and ABCA has a very smooth background, very smooth communication between each and every doctor. We talk with all the seniors, with all the juniors, and we make sure कि हम जितने भी members हैं we communicate करें, अपनी problems को discuss करें और एक दूसरे के साथ support करें. यही एक major ABCA का aim है कि taking all the doctors under one roof and connecting all the homeopaths under one roof. ये मैटर नहीं कर रहा यहाँ पर कि आप किस तरह से प्रैक्टिस कर रहे हैं. If you're practicing on a mind method, if you're practicing on a Segal's, if you're practicing classical, if you're practicing therapeutic, if you're practicing any way but homeopathy, and you are a registered doctor, you're most welcome in ABCA. The most major aim we want to communicate on every platform. मैं every platform of ABCA ये promote करने की कोशिश करती हूँ कि हम यहाँ पर कहीं पे भी कोई जजमेंट नहीं है कि आप क्या प्रैक्टिस कर रहे हैं. इंपॉर्टेंट है आप होम्योपैथी प्रैक्टिस कर रहे हैं, एंड कम टुगेदर सो दैट वी कैन सेव आवरसेल्फ and we can grow together. Important is hum as a community, as a homeopath, are we growing, are we satisfied with our practice, how to increase our practice. There are so many senior doctors and well established doctors which help us ki how to improve ourselves, how to become a better person in market also. So these are the tips which ABC is there to help you. Legally, how the registration process and the way you open the clinic is been taken care of. साथ साथ अभी इंपॉर्टेंट थिंग विच आई वांट टू शेयर इज 1 जून को हमारा एक मेडिकल लीगल सीएमई प्लस हमारा एक एलोपैथिक सीएमई हमारा फरीदाबाद में हो रहा है. सो वी वांट यू to promote that. वहां पर हम BHMS 2022, 23, 24 and 25 pass outs को ABCA is felicitating and giving an honorary award to them, and we will explain about the ABCA things, ABCA working there, and this is the free of cost, and please promote 1st June Maringo Asia Hospital from 3 to 6 p.m. 4 years, so 23, 24, 25 pass outs are most welcome there. Plus our ABCA members will be there. Not only the students will be there, all the ABCA members, senior and junior members will be there, and will be attending CMEs and will be attending and talking about ABCA working. Plus we have a one cover you program there, which is the medical legal insurance coverage. वहां पर किसी को भी कोई issue ho regarding the insurance, this is going to be there to all the members. It is for the free of cost. वहां पर वो लोग पर डॉक्टर 10 लाख कवरेज दे रहे हैं. आपके जो भी डाउट्स है रिगार्डिंग द इंश्योरेंस, मेडिकल लीगल इंश्योरेंस, आप उनसे वहां पूछ सकते हैं. द टीम विल बी कमिंग देयर फॉर हाफ एन आवर presentation, so that you can ask your all the questions and doubts how the medical legal things are going to help homeopath on a private practice. These are the questions which is coming to many doctors. You are open to talk to them and ask about the queries. If you like it, then you can go for it, because this is only given by ABCA, which is अगेन द बेसिक कोर इज एबीसीए का मेडिको लीगल इज द बेसिक कोर। यहाँ पर बहुत सारे लीगल इश्यूज डॉक्टर प्रजापति सॉल्व आउट करते हैं एज अ लीगल बैकग्राउंड, प्लस ही इज कम्युनिकेटिंग ऑल द इश्यूज कि ये सारी प्रॉब्लम्स आप लोगों को फेस ना करनी पड़े इन नियर फ्यूचर। आप सब ऑल द मेंबर्स शुड बी फुली फ्लेज नॉलेजेबल अबाउट दीज थिंग्स। हमारे क्या लॉज है, हमारी क्या लिमिटेशंस हैं, हम क्या सर्टिफिकेट्स दे सकते हैं, हम प्रिस्क्रिप्शन बेस्ड जब हम प्रिस्क्रिप्शन करते हैं हमारे पास क्या राइट्स है और हमारे पास क्या राइट्स नहीं है, ये सारी चीजें हमें क्लियर रहनी चाहिए जब whenever we are doing a private practice, so that make you more confident as a homeopath and in a society you become a more important person कि आप कहीं पे भी स्टैंड कर सकते हैं और अपनी बात को कम्युनिकेट कर सकते हैं। So 1st June we are organizing this, so please all the doctors आप अपने अपने लेवल पे भी कम्युनिकेट कीजिए to the students who are the young doctors who is coming out, so that we can as a ABC this is our responsibility to communicate all the things, all the legal authorities and legal things to our new coming students. And important क्या है हमारी membership में हम right now the ABCA membership is 5100 for the lifetime membership, and if you want to have a post holder then you have to pay 6100. These are the membership which has been going on right now, जिसके अंदर एक DRF सीको का सॉफ्टवेयर प्लस ये कवर अप का इंश्योरेंस will be free for the lifetime memberships. I hope I have conveyed the data and the information about the ABCA, and ABCA का जो मेन पर्सन है he is the Dr. DC Prajapati. If sir have joined, I want him to speak something about him. Dr. DC Prajapati, are you there?
Yes.
Oh, thank you so much, sir. Sir, now over to you, sir.
दरअसल मैं बहुत देर से ट्राई कर रहा था, मुझे पैनलिस्ट नहीं बनाया था आप लोगों ने। अभी मैंने कॉल किया है तो मैं वंचित रह गया जसलीन को शुभकामनाएं देने के लिए, तो मैं उन्हें शुभकामनाएं देता हूं कि बहुत अच्छी तरीके से उन्होंने अपनी तैयारी करी और उनकी जो प्रेजेंटेशन है वाकई में वो राष्ट्रीय स्तर की है, नेशनल स्तर की है। तो बहुत बहुत शुभकामनाएं जसलीन को, बहुत अच्छी जानकारी उन्होंने दी। और हम लगे हुए हैं गर्भ संस्कार में। जिस प्रकार से पेट में बालक आता है उसी दिन से हमें बहुत सारी ऐसी बातों का ध्यान रखना पड़ता है, नहीं तो बच्चे पे जैसे अभिमन्यु का अभिमन्यु ने बहुत सारी बातें सीख ली थी, वैसे ही काफी ऐसे मैं आपको उदाहरण दे सकता हूं जो बालक सीखता है। तो हमारे बीच में जैसा वातावरण होता है बच्चा वैसा ही होता है। बहुत बहुत शुभकामनाएं जसलीन को और
Thank
मेरी
you,
तरफ
sir.
से बधाइयां स्वीकार करें। हाँ
Thank you
जसलीन
so
जी,
much, sir.
और
Thank you, sir.
आगे बढ़े। आप एबीसीए की आप मेंबर हैं?
हाँ जी सर, यस सर।
गुड, हमारे लिए गर्व का विषय है ये कि आप जैसे लोग हैं, और हम ये चाहेंगे कि आपको ये प्लेटफॉर्म मिलता रहे। और अभी तो हमारी ये छोटी सी एक पहल है मदर्स डे पर, और अभी राष्ट्रीय स्तर पर भी हम करेंगे और आपकी सहायता लेंगे। जैसा कि
Definitely.
डॉक्टर नेहा जी ने बताया कि हमारे जो कार्यक्रम है उनके बारे में बताया, खास करके हम शिक्षा और स्वास्थ्य पर ध्यान दे रहे हैं। 5,000 से ज्यादा कैंप, आप कल्पना नहीं करेंगे, 5,000 से ज्यादा कैंप हमने होम्योपैथी के दिल्ली और एनसीआर में लगाए हैं। थोड़ा सा होम्योपैथी को दिल्ली और एनसीआर में बढ़ाने का क्रेडिट वो एबीसीए को भी जाता है। तो मैं आप सभी लोगों से आह्वान करूंगा कि ज्यादा से ज्यादा मेंबरशिप एबीसीए की आप लोग करवाएं और करें। और 1 जून का, जैसा कि डॉक्टर नेहा जी ने बताया, 1 जून का
सर प्लीज अनम्यूट योरसेल्फ, आपकी आवाज चली गई है।
हाँ, पता नहीं क्या हुआ। चलिए, तो मैं ये कह रहा था कि 1 जून को बहुत सुंदर कार्यक्रम होने जा रहा है जिसमें आप सभी लोगों ने अपनी सहभागिता निभानी है, और आप सभी लोगों के सहयोग से रहेगा, जैसा कि डॉक्टर नेहा जी ने बताया। और मैंने ये सभी लोगों को अपनी तरफ से ये कह रखा है कि जो बेटर कर रहा है वो अपने आप को प्रेसिडेंट अध्यक्ष समझे और लगातार कंटिन्यू जारी रखे। तो आपको शुभकामनाएं, और बहुत अच्छा बता दिया डॉक्टर नेहा जी ने। हम बहुत सारे कार्यक्रमों को आगे बढ़ा रहे हैं साथ में। जितने होम्योपैथ हैं, हम नहीं चाहते कि होम्योपैथ करने के बाद कोई भी डॉक्टर दूसरे लाइन में जाए, कोई और नौकरी करे, कोई और काम करे। एक ऐसी अम्ब्रीला लेकर के हम उपस्थित हुए हैं जिससे होम्योपैथ और होम्योपैथिक का विकास होगा। आप सभी का धन्यवाद, शुभकामनाएं।
Thank you so much, sir. Yes, this is right. With the point I have missed कि हमने last year से अब तक में near about 25 camps organize कर दिए हैं, and more than 3,000 से भी ज्यादा के करीब हम patients cover कर चुके हैं in ABCA. And सबसे important कि अभी lastly हमने एक van ABCA के अंडर ली है। आप सबको इसके बारे में नॉलेज है, and for that this is all because of the contribution, because of the teamwork by all of you and all the members. Thank you so much. And this is a big achievement for ABCA कि we have a homeopathic van and we are promoting homeopathic camps in a rural areas regular basis पे. And near future we are also going to expand our camps in nearby cities also. Like अभी मथुरा वृंदावन की भी बात चल रही है कि we are going to organize a camp there. And आप लोग हाँ जो interested होंगे we will organize very early and we can take a team out there. And हमारी मथुरा की भी वहाँ टीम है, and ABCA की टीम अब नेशनल लेवल पे भी बहुत सारी बन गई हैं। हमारा we have a very good president in Punjab, we have a Chandigarh president, we have the president in Mathura as well. There are many doctors who has been joined on a national scale as well. So ABCA is spreading our wings and you all are the part of it, and thank you for that cooperation and making every event a success because of the teamwork. And that is the main beauty of ABCA. We work together, we grow together. Thank you.
Thank you so much, Dr. Neha and Dr. Prajapati, sir, for inciting us into such a wonderful, everything about ABCA. We are really glad being part of ABCA family. Now, she will talk about a few lines about her NGO and detail us about it. Dr. Rashmi holds a bachelor's degree in homeopathy from Nehru Homeopathic Medical College, affiliated to Delhi University, and diploma in naturopathy and yoga. She is into homeopathic practice since last 25 years and running her own clinic in Rohini, Delhi. Also a STEAM mentor by passion, she strongly believes that if girls are given the right mentoring, resources, and opportunities, they can be great change makers, innovators, and entrepreneurs. She is one of the directors of STEAM Vision Foundation, a non-profit organization, and founder and CEO at STEAM Edu Learning Private Limited, incubated under IGDTUW Anveshan Foundation Incubation Center, a business incubator of Delhi government. Yes, over to you, Dr. Rashmi.
Thank you, Harpreet ji, for introducing me with the good lines. Thank you so much. And Namaste, Prajapati sir. And I'm greatly honored to present our organization in front of the esteemed doctors here. Thank you, ABCA, for giving us the platform. And I would like to say that STEAM Vision Foundation, I am part of STEAM Vision Foundation since its inception in 2015. And you must be wondering what STEAM meant, because by profession, I'm a doctor, homeopathic physician, as you all are, a healthcare professional as well, and trained in yoga and naturopathy. And along with that, I had a passion for technology, and that is STEAM. And what is STEAM exactly? STEAM means science, technology, engineering, arts, and mathematics. You all must be knowing about STEM education. We have added arts to it. Arts mean communication, critical thinking, problem solving. And in order, these all subjects are integrated in our learning so that the students can foster towards, like they are fostered for innovation, entrepreneurship, critical thinking, communication, and problem solving skills. As you know, this is a digital era and it's always evolving. So we must upgrade ourselves as healthcare professionals towards it. And our organization is non-for-profit organization, a Section 8 company. We started way back in 2015 with the efforts of our mentor from US director, Mr. Chandra Malik, and we started Steam Vision Foundation. So I'm sharing my screen, just a sec. So in 2015, with the aim of reaching to the last student of the society based on STEAM education, so that they can be a part of the growing nation, because India needs in making digital India. So in 2015, our mentor from US had an idea that why not every student of the area where which is underserved, which is remote, which is like ABCA, we are aiming for very remote areas which cannot afford this education. So we are aiming for that. So let me share my presentation first. Okay. So actually, our inspiration is Swami Vivekananda when he said, if the student can't reach the education needs to reach him. And by means of our association, we are moving towards every student through offline and online method. And also Dr. Kalam, who said that the best brains, they are situated on the back benches, and every student has the right for education. So we went towards it, starting our inception in 2015 with running STEAM education classes in online from a very remote and a high altitude area, Ladakh. And during that course, during a journey as a STEAM mentor, we started classes in the remotest area, villages in Delhi. And as you can see, that learning myself, like technology and like sharing, means an increase in knowledge. So discussing, especially girls. So actually girls, as you say, it's a day for the girl and the mothers. So during that journey, we also had an opportunity to present towards the faculty of Indira Gandhi Teddy Technical University, that is the #1 Asia's government college of Asia. And as you can see, we are presenting our startup to them. And we got incubated and we started working with them. And during that journey, I happened to mentor several kids, especially girls, in offline and online method, giving them education, like mentoring them on design thinking, ideation, problem solving, and also mentoring girls for the competition so that they can prepare themselves, find out a problem in the society, and address it through a technical solution. So during that, they built up skills of team, working together, making a platform and learning skills accordingly so that they can solve the problem in the form of apps or AI-based solutions. So during 2024, we mentored almost 250 girls from all over India, from Madhya Pradesh, Assam, Kashmir, Ladakh, Uttar Pradesh, and we happened to build more than 50 apps, and that were presented in the international competition, that is a global competition called Technovation. And I have with me my co-director Tanya also with us. So we also got an award for 2024 for reaching out to more than 25,000 children, students, especially girls all over India, and we got the award for that. So not taking much of the time, during that period also, I also happened to upgrade myself in different skills like app development, VR, like robotics, as well as many other things. And I could build up my own website, manage it, handle my social media platforms. As you know, as healthcare professionals, we need to know about the technology, because technology is also evolving in healthcare center and healthcare areas where even if a smallest thing can be like diagnostic tools also can be, AI can be a good platform. So you can see my website here. So I have also a YouTube channel, and where I usually discuss the medical problems also, and other YouTube channel of the company, where I address the problems, that is the education, how we can align our education to NEP. So not taking much time, I call upon Tanya with me. She's MTech in AI and data science, to present more efforts of our company, Steam Vision Foundation. So welcome, Tanya. Can we have you?
Namaste, everyone. I feel so privileged to be present here among so many senior doctors who are doing so much for our society. And in today's presentation of ma'am, where I understood a lot of concepts and how doctors can help heal everyone in different ways. So it's really like I feel myself very lucky to be here today. So yeah, the ma'am has told almost everything. So I can show you, I can just share some glimpses with you so that you can understand. And also today we would like to take this opportunity to invite all of you to be part of Steam Vision Foundation, because as Dr. Rashmi ma'am is here with us, and she's mentoring students. So not only we have technology now, we also have the privilege of giving students access to medical help and guidance in like health. Like Dr. Ashma has taken a lot of sessions on yoga, a lot of sessions on like girls' health, menstruation, and all of those things. So we are running these programs across India in Ladakh. This one is in Delhi, and then Bhaskar Sanskar Kendra is in Assam. Gursikh Innovation Center. We run these programs in Gurudwaras, Madhav Steam Lab in Madhya Pradesh. Nai Disha is in Vasant Kunj, Delhi, Spandan in Madhya Pradesh, and then we have different programs, like the one which I would like to talk about is Team Talks, where we invite a senior personalities and they guide students. Like our students become the anchors, and and those seniors guide students. So I think I will take this opportunity to invite all of you, because we are mentoring students to become the next generations of innovators and entrepreneurs. So they are learning technology, but now many of them are interested in using this technology to solve medical problems. So with all of your help, we can achieve more, and we can guide students towards right medical learning plus technology, as Dr. Ashwam also guided in students on various apps, which has reached to the finalists, like Eat What You Need, where students, just take the picture of the food and they can analyze, okay, what are the resources that I'm going to have with this food. And the one was based on the first aid, and the other was was based on how we can help animals, and how will it help in community health. So all of that we were able to do because of Dr. Rashmi ma'am's medical background. So herein I would also like to invite all of you. And also, like I was sharing Dr. Rashmi ma'am's homeopathy list website. So she took the initiative to bring this online during COVID. And even myself and my family, we were suffering from COVID. So she was the one who consulted us online. And then we came on the idea and mentioned that we can help doctors to have their website, and people from around the world can consult them online. So we have also Naval here, who is managing today from Steam Vision Foundation this event. So he also has Navlik Media, which can help you all to have such kind of website. But ma'am learned herself and created this. And so yeah, we wanted to share all of this, that how we are helping students to have digital knowledge, and how can we help our doctors community, and together we all can grow on the basis of digital literacy in today's era. Thank you so much, everyone, for giving us this beautiful opportunity to be among all of beautiful doctors and present our work. Thank you so much.
Thank you, Tanya.
And I got to know about the organization, Dr. Prajapati sir and Dr. Neha ma'am. So thank you, everyone.
Thank you. And we all invite you all to have a glimpses like visit our website and leave your comment and what you need in, like you can be also a mentor to our students in some healthcare like issues they are addressing and they are making projects on that. So we welcome you all. Thank you. Thank you so much.
Do share your website link on the WhatsApp groups.
Sure, sure.
Um,
Thank you, ma'am.
I want to thanks Dr. Rashmi first of all. Dr. Rashmi, it is beautiful to see you working like this, and it's like an inspiration for all of us. ठीक है, सिर्फ होम्योपैथी नहीं करना है, and there's no limit of learning, and this is the ideal example you have shown to us, and this is the way जब हम मिलते हैं, बात करते हैं, इंस्पायर करते हैं हम एक दूसरे को. So आज जो आपने प्रेजेंटेशन दी जो हमें नहीं पता थी exactly कि the work you do beside homeopathic practice, this is wonderful. And digitally अपने आप को अपग्रेड करना ये बहुत जरूरी है आज के टाइम पे, and you have done it, and you are giving guidance to so many people and so many children. So this is again a very important thing that you have conveyed, that as as a person हमारा duty बनता है to help other. As a doctor also we are trying to help, और ABCA का भी यही है कि we want to serve for humanity, and you also serving for humanity. Plus आपने children को इतना educate किया, this is amazing, and we are really happy to see this, and honored to see you as a main person in a core team of ABCA. Thank you so much, and you're very inspiring. हम आपसे बहुत कुछ learn करने वाले हैं अब, and
और ज्यादा से ज्यादा लोग ज्वाइन भी करेंगे आपके टीम
जी
को.
जी. Actually, I would like to say
Absolutely,
that
ma'am.
yeah, actually STEAM education is nothing different. It's an amalgamation, because एक ऑब्जेक्ट भी होता है तो उसपे सारी चीज आपको समझ में आती है. तो एजुकेशन अप्लाइड एजुकेशन है. It's by learning, and we are evolving as we learn. So healthcare जो है, I would find that it is also STEAM, and STEAM is also healthcare. So nothing is different, and our vision and mission is same, to serve. So we'll be there together.
Yes, sure,
Thank you
ma'am.
so much.
And
So
it is
now
it's
you are
great.
that bridge that will bring us
Connect.
together.
And
Yes.
you can virtually visit Ladakh and see what healthcare issues they are facing in the icy cold. So through this platform, I could reach everything to the south, to Trivandrum, to Bangalore, to Assam, to Arunachal Pradesh, even to Pakistan also. Some students are there from Kashmir also. We have an
That's
initiative
great,
in
ma'am.
Baramulla. So the different things we can reach out, and in the education as well as health. Thank you so
Yes,
much,
ma'am.
Prajapati sir.
you-
Thank you.
You are a true example of women empowerment and entrepreneur.
Actually, 70 to 80% are girls, and we also have an initiative called Genius, that is
Oh.
girls empowering New India using STEAM. And New India is Vasudev Kutumbakam, whole world.
Yes. Okay. And I want to say thank you to Tanya ma'am as well. Great presentation, ma'am. And I have seen your information which Dr. Rashmi has shared. You're amazing, amazing, ma'am. And we give you a lot of wishes for your future. And really nice the presentation, the team you are working as a team. And if you need us to involve in a way up, you're most welcome, and you can educate us on a digital platform as well, because we are a group of a very well educated doctors, and very honored doctors are there, and legendary doctors are there in ABCA. So जैसे भी अगर लगेगा आप हमको communicate कीजिए, हम आपसे communicate कीजिए, how we can serve for the humanity and work together. We are open, and we will be very helpful and thankful for that. And Dr. Dhimisha ma'am want to say something, and then Dr. Prajapati sir will say something. Thank you.
Yes, thank you, Tanya. The presentation was so inspiring कि ऐसा लग रहा था कि सब अभी मेंबर बन ही जाएंगे इस टीम में. So looking
So
forward
that's what
to
we
seeing
want
you
to
again.
bring all of you
And
together.
let's continue. It's high time for our next speaker. Before that, if Dr. Prajapati, sir, आप कुछ कहेंगे? प्रजापति सर.
हाँ, मैं कुछ कहूँगा, रिपीट करूँगा. मैं जब डॉक्टर रश्मि को पहली बार जब मैंने सुना था, देखा था, तो उनके बारे में पता लगाना चाहा, मैंने बात करी. उनके जितने कार्यक्रम हैं ये शिक्षा को लेकर के, स्वास्थ्य को लेकर के वो जुड़ी हैं, तो मुझे बहुत अच्छा लगा था. और वाकई में काबिले तारीफ है। और मैं ये चाहता हूँ कि बच्चों के विकास के लिए, खास करके वे बच्चे जो जिन्हें काउंसलिंग की जरूरत है इस समय पे, क्योंकि केवल शिक्षा के स्तर को हम ठीक कर सकते हैं, आगे बढ़ा सकते हैं, पर उसके साथ साथ कुछ काउंसलिंग की जरूरत है। आज की डेट में बच्चे चिड़चिड़ेपन के शिकार हो रहे हैं, बहुत सारे मोबाइल फोन के दुष्प्रभाव आ रहे हैं। आप ये कहोगे, मम्मी बच्चे को ये कहेगी बेटा ये नहीं करना, वो बच्चा उसको करेगा। इतनी ज्यादा मनोदशा बच्चों की हो रही है खराब। उसको ठीक करने के लिए मैं चाहता हूँ जो रश्मि जी और तान्या जी का जो ये एनजीओ ऑर्गेनाइजेशन है, इसमें जहां भी एबीसीए की किसी भी तरीके से लीगल में, हेल्थ में, मेडिसिन में, कैंप्स में डॉक्टरों को अगर जरूरत और काउंसलिंग को अगर जरूरत पड़ती है तो आप बेहिचक संपर्क करें और हम तुरंत तैयार रहेंगे। आप आउट ऑफ स्टेशन में भी इस कार्यक्रम को लेकर के जा सकते हो, जहां पर हमारी जरूरत लगती है आपको, तो आप इसको आगे बढ़ाएंगे। हमारा जो उद्देश्य है वो घर घर तक अपनी पैथी को पहुंचाने का है, और आपका उद्देश्य भी लगभग यही है, शिक्षा और स्वास्थ्य को हर घर तक पहुंचाने का। तो मैं आपके कार्यक्रमों की भूरी भूरी प्रशंसा करता हूं और शुभकामनाएं देता हूं और बधाई देता हूं रश्मि जी को और तान्या जी को कि ये आपके कार्यक्रम अनवरत जारी रहे। हम आपके साथ हैं, एबीसी आपके साथ है, जहां कहीं भी जरूरत पड़ेगी आप जरूर बताएं। और मैं तो ये कह रहा हूँ कि इस महीने कोई कार्यक्रम आप बना लें और हम जरूर आएंगे, खास करके जो मैंने कहा है काउंसलिंग वगैरह का, और उसके साथ साथ हम चिकित्सा का भी कर लेंगे। आपने देखा होगा हमने ड्रग एडिक्शन पर भी, मोबाइल के दुष्प्रभाव पर भी, किस प्रकार का खान पान हो, क्योंकि लाइफस्टाइल डिजीज है। भारत एक सबसे बड़ा देश है पुरुषों में डायबिटीज के लिए, भारत सबसे बड़ा देश है महिलाओं में थायराइड के लिए। ये सब अनियमित खान पान से हो रहा है, और ये खान पान की जानकारी हम जैसे लोग उपस्थित होकर के दे सकते हैं, जिससे बहुत सारी बीमारियों से निजात पाया जा सकता है। आप सभी का बहुत बहुत धन्यवाद, खास करके रश्मि जी, तान्या जी और जसलीन जी, हिमीशा जी, नेहा जी, हरप्रीत जी। देखिए, बहुत डॉक्टर, बहुत सारी प्रतिभा जो है वो तभी निकल के आती हैं जब उनको मौका दिया जाता है। और एबीसीए का जो मंच है वो हमने कह रखा है कि हम सबको मौका देते हैं, सबको आगे बढ़ाने का हमने एक अ, मंच बनाया है एबीसी के द्वारा। आप सभी लोगों का फिर से एक बार धन्यवाद, शुभकामनाएं।
Thank you, sir. Thank you.
थैंक यू सो मच प्रजापति सर, इतने अच्छी इन्फ्लुएंशियल लाइंस बोलने के लिए। आप हमेशा, इसीलिए मैं कहती हूँ आप गॉड फादर हैं हमारे, इतना ज्यादा सोचते हैं हम सब के बारे में और होम्योपैथी के बारे में। दैट इज रियली रियली नाइस। एंड आई वुड ऑल्सो लाइक टू से लाइक योर वर्क मिस तान्या एंड डॉक्टर रश्मि, इट इज रियली इंस्पायरिंग. आई विश India, in fact, the world has more women like you who are working towards, the humanity. That is really commendable. So I'd like to come to the next speaker. Welcome our next speaker of
मैं
the
एक
day.
बात और जोड़ना चाहूंगा हरप्रीत जी।
हाँ जी,
आ,
हाँ जी सर.
पिछले पिछले एक वर्ष से जो आप लोग कार्यक्रम कर रहे हैं, एबीसीए की टीम, खास करके 90%, 99% फीमेल, मैं आपको दिली तमन्ना ही बताता हूँ, मेरा दिल करता है कि आपके साथ में गले लगाऊं, पर जो सीमाएं होती हैं उन सीमाओं से डर करके मैं आपको ये नहीं कर पाता। पर मैं अपनी दिली इच्छाएं, जो मेरे हृदय से जो शुभकामनाएं और आशीर्वाद है, वो आप सब लोगों के लिए है। थैंक यू।
Thank you, sir, for your blessings. Thank you, sir.
थैंक यू सो मच सर फॉर योर ब्लेसिंग्स. आपकी हमेशा बस ब्लेसिंग्स हमारे साथ हो, बस वही चाहिए. तो हम अब नेक्स्ट स्पीकर पे जाते हैं. वेलकम डॉक्टर योगिता गोयल. शी इज अ BHMS फ्रॉम BR Sur Homeopathic Medical College, Delhi. She has worked with Dr. Lal Singh Foundation during her internship for 2 years and thereafter started a private practice by the name of Dr. Goel's Homeopathy in Crossing Republic, Ghaziabad. She has a work experience of around 10 years. She has also done a certificate course in yoga and naturopathy. Over to you, Dr. Yogita.
Thank you, Dr. Harpreet ma'am, for this wonderful introduction. Hello, everyone. First of all, happy Mother's Day to everyone. Motherhood is near to divinity. It is the highest and holiest service to be assumed by mankind. This is the best thing we experience in our life. So I'm start sharing my screen. Visible? Okay. So my topic is maternal health issues during pregnancy and its homeopathic management. As the doctors, we all know it already. So just revise it together. So what do you understand by maternal health? It refers to the health of women during pregnancy, childbirth, and postnatal period. Each stage should be a positive experience, ensuring women and their babies to reach their full potential of health and well-being. The most common causes of maternal injury and death are excessive blood loss, infection, high blood pressure, unsafe abortion, and obstructed labor. These all things we already know very well. Every pregnancy and birth is unique. All women must have access to respectful and high quality maternity care. This is a fundamental right. Every woman must have access to respectful and high quality maternity care. Now, as we discuss maternal health issues, we can broadly classify them in three categories. First is nutritional. Nutritional is deficiencies like anemia and poor dietary intake. Nutritional deficiency in pregnancy can significantly impact both mother and developing fetus. Some micronutrients are also there, which is very much required for a healthy pregnancy and a healthy baby for both mother and child. So micronutrient deficiencies such as iron, folate, iodine can contribute vitamin D are essential. And in these deficiency of these vitamins can contribute to conditions like anemia, preeclampsia, developmental issues in a child. A balanced diet, prenatal vitamins, and regular prenatal care are crucial for preventing and addressing these deficiencies. Second is medical health issues like high blood pressure, gestational diabetes, preeclampsia. Preeclampsia is a condition when there is repeated, consistent high blood pressure is there. Infections such as most common are STIs, sexually transmitted infections. Next, we came to mental health issues. We already discussed earlier, as Dr. Jasmeen already briefed us about this, depression and anxiety. Other concerns are advanced maternal age if the mother is 35 years of age or above it. Next is maternal obesity and substance abuse. Now, high blood pressure, we all know, when arteries carrying blood are narrowed, it makes hard for blood to reach the placenta, which provides nutrient and oxygen to fetus. Reduced blood flow can slow the growth of fetus, place the mother at greater risk of preterm labor and preeclampsia. It usually develops in pregnancy during second half and goes away after delivery. In most cases, it happens. Next is gestational diabetes. It is the condition when the woman is not having any diabetes before pregnancy. It develops during pregnancy and goes away after delivery. In this, hormonal changes from pregnancy causes body either not to make enough insulin or not to use it normally. If not controlled, It can lead to hypertension from preeclampsia and having a large infant, which increases the risk of C-section. Next, we came to infections. Infections like STIs cause severe complication for mother and baby, such as chlamydia, which causes pneumonia and conjunctivitis in newborn. If untreated, gonorrhea can lead to eye infections in newborns, potentially causing blindness if untreated. HIV can be transmitted from mother to baby during pregnancy, childbirth, or breastfeeding. Other infections are like hepatitis B, herpes, syphilis. These are also viral infections. Chlamydia, gonorrhea, hepatitis B, herpes, and syphilis can easily be treatable with homeopathy. We all know symptomatic treatment, proper case taking helps in relieving these symptoms. Now, preventing and managing infections. Prevention is better than cure, as we all know. So, due to this reason, planning a pregnancy is utmost important so that all the screening investigation for STIs can be done beforehand. So there will be less chances to miscarriage, ectopic pregnancy, preterm labor and delivery, low birth weight, congenital anomalies, and stillbirth. Screening for STIs during prenatal care is crucial, especially in first trimester. Obviously, as the body already starts changing, hormones are rising, changing in the body. Now the next condition, preeclampsia, serious medical condition which can lead to preterm delivery and death. Not all women are at high risk. Some high risk factors include early pregnancies when the body of the woman is not fully prepared for delivery or for delivering a healthy child. Next is preeclampsia in previous pregnancies. Other conditions such as hypertension, diabetes mellitus, or being 35 years of age and older, which we already discussed, carrying multiple fetus and obesity. Preterm labor, labor which begins before 37 weeks of pregnancy. So babies which are born before 37 weeks of pregnancy are at higher risk for health problems. Progesterone is the natural hormone produced during pregnancy, may be used to prevent preterm birth in certain women. Now, mental health issues and their management with homeopathy. Mental health issues, as we already discussed. Maternal mental health, also known as perinatal mental health, refers to a mother's overall emotional, social, and mental well-being both during and after pregnancy. So, mother's mental health is utmost important not only during pregnancy but after delivery also. As many as 1 in 5 women will have mood and anxiety disorders while pregnant, with the most common being depression. Only about 10% women will seek treatment for these concerns. What causes stress during pregnancy? Physical pain, fear of labor, insomnia, hormonal changes, low self-esteem. So we discuss about depression and anxiety. We already know, being a doctors, depression is feeling sad, low, down, not interested in anything, any activity, or in any in talking to anyone. Anxiety is the feeling of nervousness, worriness, fearfulness. So pregnancy brings a range of emotions. Many women feel overwhelmed, sad और anxious. बहुत से लोग अपनी प्रेगनेंसी को लेके बहुत हैप्पी फील करते हैं, कुछ डिस्टर्ब होते हैं क्योंकि वो एक्सेप्ट नहीं कर पा रहे होते. Sometimes pregnancies are not planned actually. So that at that time they take some time to adapt. For many women, these feelings go away on their own, but for some women, these emotions are more serious and may stay for some time. Now, when we come to homeopathic management, before that, I want I want to discuss. As pregnancy begins, a female experience many changes, many symptoms like nausea, vomiting, morning sickness, heartburn, water brush, colic, constipation, diarrhea, urinary difficulties, toothache, headache. These all are due to hormonal changes which are started in the body. Pain in breast, varicose veins, piles, edema, cramps, abortion and miscarriages. So when we talk about nutritional deficiency, first iron deficiency anemia, the first and foremost medicine is Ferromet, which is we already know all the common medicines. So Ferromet is the prime medicine for anemia. Next is Calcarea carb. When there is obstinate cases where there is loss of appetite, acidity of stomach, leukorrhea, and pallor of face, especially in scrofulous patients. It is often used for calcium and phosphorus. Natramur is for the patients who crave salty foods and show signs of anemia or general weakness. China for chronic weakness, loss of appetite, or digestive issues that make it hard to absorb nutrients. These all are some common medicines like phosphorus, silicea, arsenic, pulsatilla, lycopodium. These are colic rest medicines which we already using in our daily practice, clinical practice. Now, prevention, we all know prevention is better than cure. Preventing nutritional deficiencies. So what would we advise to our patients is eat a balanced diet, take regular meals, small meals, not eat a full meal at a time. Balanced diet, exercise regularly. Physical activity is utmost important to proper digestion. Manage stress. Stress can interfere with nutrient absorption. So important to find healthy ways to cope. Now, how can we manage stress? Sorry for interruption. We can manage stress जस्ट लाइक द एक्टिविटीज जो भी हमें पसंद है हम स्ट्रेस को कैसे मैनेज करेंगे हमें म्यूजिक सुनना पसंद है किसी से बात करना पसंद है जो हमारा पसंदीदा इंसान है हम उससे बात कर सकते हैं हम अपनी अच्छी बुक जो हमें पढ़ना पसंद है कोई भी स्पिरिचुअल एक्टिविटी कुछ भी जो हमें अच्छा लगता है हमें वो करना चाहिए मैनेज करने के लिए स्ट्रेस को सो स्पेशल सर्कमस्टांसेस में ऑब्वियसली डाइटरी इनटेक एडजस्ट करना पड़ता है it's not just fixed. With the right combination of balanced diet, lifestyle adjustments, and homeopathic remedies, you can improve overall health and protect yourself from the negative effect of nutritional deficiencies. Next, when we came to depression and anxiety, most common medicines which we can discuss, some of them already discussed with Dr. Jasmeen. First is Aconite. We all know it is one of the very good medicine when there is sudden anxiety, panic, or fear. Panic could be connected to past trauma. Pulsatilla, next is comfort remedy. Perfect for emotional ups and downs that come during pregnancy. It is particularly helpful when the patient is feeling tearful, needy, and in need of reassurance. Next is gelsemium. Gelsemium is the patient is best for the patient. I used it many times for the patient who just overwhelmed with the thought of labor and responsibilities of motherhood. During the time of labor, how can I manage? It's very painful and patient like how I can manage, especially working mothers, how I can manage my responsibilities of motherhood. Next is argentum nitricum. Same, anticipatory anxiety, worried about events like labor or delivery. accompanied with issues like nausea and diarrhea. Sepia, beautiful medicine, one of my favorite, known for its ability to help overwhelmed and exhausted, particularly when you are feeling disconnected or irritable. This also we have already discussed with Dr. Jasmeen in detail. Next is Kali phosphoricum. This gives best result usually in biochemic form, 6x potency or 12x. Next, arsenicum album, very common medicine, ignitia, we all know. Now, making health a priority for mother, this is the utmost important thing. Making health a priority. So, plenty of exercise during pregnancy, not rigorous exercises, just light exercises to make the physical movement. Focus on good nutrition, take prenatal vitamins, and try to get enough sleep. Quit smoking, avoid alcohol since these are dangerous for both developing fetus and mother. Better physical health often goes hand in hand with improved mental health. So other symptoms which we can take care of with homeopathy is almost every symptom which a woman feel in during pregnancy, such as morning sickness, noxomica, one of the polygrist medicine, vomiting with vertigo, restlessness, irritability, acid and bitter risings. This is a very good medicine for constipation, piles, water brush, and acidity, heartburn issues. Ipecac, creosote, tabacum. These all are medicines for this morning sickness issue. In Ipecac, there is undigested food and vomiting of bile. Creosote, the most valuable, and it hardly fails. Actually, it hardly fails. It usually gives result and relief to the patient. Tabacum is without vomiting, the patient is having continued sick feeling. Now again, arsenic, one of the polygrist, pulsatilla. Usually these medicines we can use for many conditions. Same, Naxomica and pulsatilla. I'm not going into details again. Now for heartburn and water brush, one of the best remedy is sulfuric acid. In sulfuric acid, the patient feel pain in the pit of stomach and it goes back in the back. This is the marked symptom. And a single dose will sort it out on its own. Lycopodium, arsenic, capsicum. These all are very good medicine and usually give result in low potencies especially. Now what we can advise to the patient, rich and digestible food, especially heavy rich foods. कोई भी heavy चीज नहीं खानी है, like बहुत spicy food, बहुत ठंडा पानी नहीं लेंगे, और वाटर इनटेक अगर चाहिए तो आधा घंटा खाने से पहले और खाने के 1 घंटा बाद अगर लेंगे तो उससे डाइजेस्टिव इशू नहीं होंगे, जो हार्टबर्न और आपको क्रॉनिक एसिडिटी की कंडीशन आ रही है वो नहीं होगी. कार्बोवेज is also one of the medicine, sensation of suffocation with flatulence and rumbling. Flatulence is the key feature. Next we come to the constipation. As I already said, Nux vomica is the medicine, very good medicine for constipation and piles. A dose of Nux vomica at the bedtime on the first day and next day sulfur in the morning. This is the combination, gives very good result and I actually use it. Patient soon get relieved. Hardly it takes 3 days for that to be better. Hydrostress is one of the specific remedy when there is slowness in the movement of walls. Sulfur, again a polygrist. Now opium, lycopodium, alumina, platinum. Opium is having obstinate constipation. Alumina patient with mental symptoms when we get. Now, what we advise is having a glass of water, either going to bed or on rising in the morning. I prefer to have it in the morning. And use of vegetables, preserved, ripe fruits is good enough. जितना फाइबर लेंगे उतना कॉन्स्टिपेशन रिलीव रहेगा. वाटर इनटेक अच्छा रखेंगे, कॉन्स्टिपेशन नहीं होगा. कॉन्स्टिपेशन नहीं होगा तो ऑब्वियसली पाइल्स भी का इशू नहीं आएगा, क्योंकि प्रेगनेंसी में हार्मोनल चेंजेस बॉडी में ऑलरेडी हो रहे हैं. तो ये बहुत कॉमन इश्यूज हैं which we usually see. Next is diarrhea. Sometimes होता है पेशेंट्स को. पल्सिटेला का डायरिया है एवरी मंथ सेम टाइम पे, मोस्टली एट नाइट, यूजुअली एट नाइट विद colicky pains. Next is chamomilla. Chamomilla is one of the trio of pains. Yellow green stools, bilious vomitings, flatulence and bitter taste and thirst. Next is dulcamara. When the weather is wet or days are hot, nights are cold, this is the medicine. Phosphoric acid when there are night sweats and frequent urging to pass urine. Sulfur, again, one of the polycrest and king of antisoric medicines. Most of the cases it's sorted out. Accessory means light food should be taken. Most suitable diet is fluid food, liquid diet. We restrict the patient to this diet for a short time, so don't get dehydrated. Urinary difficulties. This is the most common symptom. I see many patients with this. Patient is unable to pass urine. There is incontinence, or if they are going to pass urine, it just passing by drop. So these are the medicines. Pulsatilla noxomica we already discussed. Belladonna, there is relaxation of the neck of bladder, copious and frequent emissions of pale, watery or yellow turbid urine. Cantharis, one of the very specific remedy for irresistible desire with scalding, cutting and tearing pains while urination. Pheramune is one of the specific remedy for incontinence of urine during daytime. It's specifically during daytime or on coughing. Camphor, sudden and urgent retention without burning and great pain. Senna, frequent desire and passage of turbid urine which may cause it to pass urine involuntary in bed. Oculus, scanty emission pains in urethra. Now what I usually prefer is most of the cases get cured with sepia and causticum. Sepia is one of the medicine for offensive urine trial, according to Dr. Nash. Causticum, as we all know, acts on nerves. So these two medicines in combination works wonderfully. Now again, these are some mental issues which a female may get while pregnancy. I think we have already discussed. So इस सब से बचने के लिए क्या कर सकते हैं? Accessory means useful occupation combined with outdoor activities. It's being a simple walk in open area, cheerful company, or books, some good books, some positive books. If someone is interested in spiritual books, he can or she can read that. Several breathing exercises can also be beneficial, including yogic deep breathing, Ujjayi and Bhramri breathing, Ujjayi and Bhramri pranayam. These are also beneficial. Benefits of breathing exercises during pregnancy, what it causes. Stress and anxiety reduce करता है. Pain management, क्योंकि लेबर के टाइम पे जो पेन होता है उसे मैनेज करने में it will be really helpful. Next is varicose veins. Pulsatilla, again a polycyst, painful and inflamed veins causing swelling of limbs. With a patient having pulsatilla temperament, its VP, changeable mood. Hamamelis is one of the specific medicine. Aconite, in alteration with pulse, it gives very good result. It is also helpful in hemorrhoids, constipation, and bearing down pains. Belladonna, arsenic, silicate, and sulfur are also useful under certain conditions. So, in cases of varicose veins, what I advise my patients to use stockings, which can be easily available in the market, and ask them to raise their foot end of the bed. Just if they can use some pillows to raise their legs, or by putting some bricks under the bed, they can raise their whole foot end of the bed. Piles, I've already discussed Naxomica and sulfur. A dose of Naxomica at night and one of sulfur in the morning for a week or two. This will work great. So in acute cases, these may be repeated every 4 hours. Aloes, one of the specific remedy for hemorrhoids, attended with bilious derangement or torpor of liver, diarrhea or profuse bleeding. It may be administered in alteration with sulfur or may precede that remedy. Aconite we already discussed. Collinsonia hamamelis, we all know these are specific medicines for hemorrhoids. Now diet. Diet should be moderate, unstimulating and easy to digest. Coarse brown bread is sometimes unsuitable as the husks causes irritation in the rectum and produce aggravation of the disease. Avoids stimulating beverages, pepper, spices, and too much animal food. Now, as we come to end, I want to discuss two cases. One of my patient came to me at her 5th month. She visited her gynae, or cervical length was reduced. It was around 2.5. Her gynae asked her to get cervical stitching done, but there are chances of miscarriage. She was also very afraid. So she consulted me. She was my old patient, already coming for another issues. I used repertory. In repertory, Kemp's repertory, there is a rubric under female genitalia. First is abortion, and 5th to 7th month, a single medicine is given, that is sepia. I put her on sepia. Dose is thrice a day for 5th to 7th month, and complete strict bed rest along with raising her foot end of the bed. So she completed her pregnancy without the need of cervical stitching. So becoming a mother makes you realize you can do almost anything one-handed. माँ बनने के बाद सब कुछ आपको कैसे मैनेज करना है, you can already know very well. In fact, every one of us experience this. Another case is one of my teacher once told me during last month of pregnancy, if the baby is having umbilical cord around their neck, or if the position is not right, so what we can do, a single medicine he just taught me, Netramure. This is the medicine. Single dose will work, and a baby changes its position within 48 to 72 hours. Yes, I used it. So, my gratitude to all the women. ये संत कबीर जी का एक दोहा है, मुझे बहुत पसंद है. नारी निंदा ना करें, नारी रत्न की खान, नारी से नर होत है ध्रुव प्रहलाद समान. So thank you very much. I'm done.
Very nice and informative session it was, Dr. Yogita. Really, really
you,
very
ma'am. Thank
nice.
you.
Dr. Prajapati sir, please felicitate Dr. Yogita Goel ma'am and say a few
हाँ
words.
योगिता जी, बहुत बहुत शुभकामनाएं आपको, और अच्छी जानकारी
you, sir.
आपने उपलब्ध कराई हमारे चिकित्सकों को, और ये रिकॉर्ड होके हम जितने हमारे ग्रुप्स हैं सब में जाएगी, और आप आगे के लिए भी तैयार रहें। बहुत अच्छा रहा आपका, आपको बहुत बहुत शुभकामनाएं। और मैं चाहूंगा
Thank
नेहा
you
जी
so
आपको
much.
सर्टिफिकेट दें।
I want to congratulate Dr. Yogita Goel. It was a good initiative and good presentation. The therapeutics was very apt, and it was a good revision for all the doctors for this. And I want to felicitate on behalf of Sir and all the senior doctors here from ABCA. It is a good platform. Ma'am, इसी में एक point add करूंगी, जैसे आपने बताया this was your first presentation, and I really say that again ABCA is there to ignite. It is an ignition to all the doctors to come forward and have the confidence to present yourself. ABCA में हम कई बार ये डिस्कस करते हैं सर के साथ, सर स्पीकर सर कहते हैं ABCA से लो, members से लो, and ask them to come forward and present themselves so that they become a more confident person. Second point I want to add, as आपने last में जो बताया कि the motherhood, again we have listened a voice of your daughter or a son at the background. So this is, है ना, I
Yes,
don't know
ma'am.
about it, but this is the thing which shows that कि how we are working hand in hand professionally and managing the things at home. So this is the courage only women can have. Only mother can manage these things. So this is the ABCA's motivation to all the women doctors. Keep working, keep progressing and managing things hand in hand, and that's called heads off to all the doctors. And इसीलिए हम सब साथ में एक दूसरे को motivate कर रहे हैं. So keep working and keep taking ABC on our next level. And this is the presentation. I want कि sir ma'am का certificate एक बार please show कर दे.
Thank you so much.
Congratulations, ma'am.
Congratulations,
One
Dr.
query
Yogita.
is there. Yes, hypertension in early pregnancy. Yes, we can get the हम mother tinctures use कर सकते हैं. Basically, I prefer Criticus. That is having solvent properties of crustaceous and calcareous deposits
आप सभी
in
लोगों
the
को शुभकामनाएं।
arteries.
थैंक यू। मुझे निकलना पड़ेगा। धन्यवाद।
Thank you, sir.
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 Sir.
सर एक बार इफ इट इज एक बार जाने से पहले एक फोटोग्राफ लेंगे मैम. If everybody please open
All
your camera.
panelists can
Please open the camera please so that we can take a picture.
प्रजापति सर एक बार कैमरा ऑन कर दीजिए.
Sir,
Everybody, speakers and hosts and everybody, please unmute yourself and start your video.
I'm
Both the
taking.
speakers,
हाँ.
hosts, coordinators.
Can open the camera so that we can click a picture. I will click the picture. Thank you so much. I'm clicking it now. Everybody is ready? With smile. Thank you. Thank you everyone. Now you can continue, ma'am. Thank you.
Yes, ma'am. Someone has asked hypertension in early pregnancy. कैसे मैनेज करेंगे? सबसे पहले सॉल्ट इनटेक पेशेंट को कहेंगे रिड्यूस करें. अपना डाइटरी इनटेक मॉडिफाई करना पड़ेगा. Say no to high rich foods. And Crataegus is one of the best medicine which I mostly use because it has the solvent properties. It dissolves the all calcareous and crustaceous deposit which causing narrowing of the arteries. And thank you so much, ma'am, for
I
this
would like to
introduction,
add
and
one more thing.
thank you, Prajapati sir. Yes, sir.
Yes, yes.
Yes,
Thank you,
ma'am.
Dr. Yogita. It was wonderful. I would like to add one more thing, that we have very good remedies in batch flower also, which have postpartum depression plus anxieties and worries, all related to pregnancy and post-pregnancy. So one day we can have that session also on batch flower, and it's really very, very useful during and after pregnancy.
Very
Yes,
needful. We need to have it. Thank you.
okay, thank you so much, everyone, for your time.
Okay, so here we come to the close of this enriching and insightful webinar on motherhood and homeopathy. I, Dr. Dhimisha Mehta, extend a heartfelt vote of thanks on behalf of entire organizing team of ABCA. Thank you, Dr. Prajapati sir, for all your support and blessings in making this event successful. A mother of a beautiful daughter who popped up with this idea of webinar on motherhood, gave valued inputs. Her constant support and encouragement made this a hit. And she's already smiling. Thank you, Dr. Neha Kathuria, President ABCA. Thank you, Dr. Nitika and Dr. Harpreet, for steering this session so wonderfully, so beautifully, ensuring a smooth flow of the session. Dr. Jasmeen Arora, you touched the core of motherhood. It was so enlightening. It showed your expertise and experience. Thanks for all your support to empower mothers in their journey. Our second speaker, Dr. Yogita Goel, your homeopathic management is really helpful. Though these remedies are very common, but when applied aptly to the deserving patient, we get wonderful results. And finally, thank you to all our participants. Your presence, attention, and engagement made this webinar truly meaningful. Goodbye and good day.
Thank you, everyone.
Thank you, ma'am.
Thank
Thank
you
you.
so much,
Thank you,
ma'am.
Dhimisha ma'am. Thank you everyone for joining. It was a wonderful event and I hope you all had a good time. Thank you.
Okay.
See you on the
नेहा
first.
जी शांति मंत्र के साथ एंड कर सकते हैं?
जी
Sure,
जी
sure.
Sure, ma'am.
ओम सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् ओम शांति शांति शांति। आप सभी का दिन शुभ हो। नमस्कार।
Thank you so much.
Namaskar, ma'am.
And
Thank you,
thank
ma'am.
you, ma'am, for all the cooperation. Thank you. And your
Thank you,
team.
everyone. Thank you, everyone. We'll be
Thank you.
there to serve. Thank you so much.
Thank you so much.
Bye bye. Goodbye, everybody.
Bye.
Okay, goodbye.
Goodbye, ma'am.
Bye.
Goodbye,
Bye,
everyone.
ma'am. Thank you.
Shall I end?
Yes, yes.
Okay. Okay. Thank you, everyone.